A female 45-year-old presents with complaint of jaundice and pain in the right hypochondrium for 1 month. She is also in altered state of consciousness. Now we scanning the liver. Here we see the left lobe of the liver, which shows heterogeneous texture, hyperechoic and hypoechoic texture. Here we see the dilated veins of left hepatic veins. The left hepatic veins are prominent and mildly dilated. Normally these hepatic veins are not visualized. These vessels are dilated when there is increase in venous pressure or portal vein pressure. Here we also see a streak of hypoechoic area adjacent to the vessels. Now on color Doppler we see normal arterial flow adjacent to the veins. In liver there is a portal triad like hepatic vein, hepatic artery and biliary duct. Here we also see the hypoechoic area on the upper border of the liver or subdiaphragmatic area. Now we see the multiple hypoechoic focal lesions as we scanning between the ribs. So it is difficult to properly visualize the focal lesions as rib shadows also creates hindrance. Here we see the heterogeneous lesion is continuous as branching. Now on color Doppler there is no flow in these focal lesions, but we see the arterial flow. Which is continuous or maybe sub-interrupted. We see no flow in these focal lesions. On power Doppler, we also see there is continuous flow in the veins. Here we see the arterial flow, which is also appears to be continuous and normal, but we see these focal lesions are continuous as branching adjacent to the vessels. Here we see the venous flow is minimally interrupted on power Doppler. Now here we see echogenic shadows. These shadows appears when there is air in the biliary ducts. Here we measure the part of the liver which containing focal lesions. Here it gives a mass-like appearance in a longitudinal view. The area of focal lesion is measures 83 into 48 millimeter. Now we also see the multiple focal lesions present in the right lobe of the liver. Now we also see multiple echogenic shadows in the liver. It is difficult to scan between the ribs as where there is very narrow space in the female ribs. Here we see anechoic fluid for the left lobe of the liver. There is also some septations present. Now we measure the size of the liver from cranocaudal view. The approximate size of the liver is 17 centimeter or 171 millimeter. The normal size of liver is 16 centimeter. Now we scanning the gallbladder. Here we see calculi. Now we measure the size of calculi. The two calculi are lies adjacent to each other. The collectively measuring size of two calculi are 22 millimeter. Here we see the Common bile duct and portal vein. Both are always lies adjacent to each other. Now we measure the size of portal vein. The size of portal vein is 4.6 millimeter, which is normal. The normal size of portal vein is up to 12 millimeter. Now we measure the size of common bile duct, which is 5 millimeter. The normal size of common bile duct is up to 6 millimeter. Now here we see the bile duct is dilated away from porta hepatis, where its diameter is 7 millimeter, but at porta hepatis its diameter was 5 millimeter. The middle part of the common bile duct is dilated. Now we will also measure the wall of gallbladder. The wall of gallbladder is 4.4 millimeter thickened. It means there is also inflammation in the gallbladder wall. The normal wall of gallbladder thickness is up to 3 millimeter. Now we scan the spleen. Its inferior part appears to be thickened and appear as a separate lobe enlargement. Now we measure the size of spleen. The size of spleen is 135 millimeter or 13.5 centimeter, which is also increased. The normal size of spleen is up to 12 centimeter. Here we scanning the urinary bladder or pelvis. Minimal fluid also present in the pelvis, and there also we see septations in the fluid. Yes. Now how we will write report. The liver is enlarged in size 17 centimeter and shows heterogeneous texture. The intrahepatic biliary ducts are dilated and contain multiple strictures in the right and left lobe. Air is also present in the biliary ducts of right lobe of the liver. The gallbladder contains Two calculi collectively measures 22 mm. The wall of gallbladders are also thickened 4.4 mm. The normal size of gallbladder walls are up to 3 mm. The middle part of CBD is also dilated 7.1 mm. Septated fluid present in the right subdiaphragmatic area and in the pelvis. The spleen is also enlarged 13.5 cm. The both kidneys and bladder is normal. The ultrasound diagnosis is primary sclerosing cholangitis with liver cirrhosis, dilated CBD, cholecystitis with cholelithiasis, pneumobilia, and septated fluid collection or debrinous fluid present in the right subdiaphragmatic area and in the pelvis.